Hi, congratulations. That's a long appointment, but I wanted to give you some reinforcement of what we talked about at the end of the appointment so you have a reference to come back to just in case everything wasn't entirely clear. So, a few things to think about after the visit. The first and most obvious is there's going to be some soreness in your mouth. With the long appointment, your jaw might be tired up around here. Your gums more than likely are going to be somewhat sore when you brush them for the next few days, and as well as the teeth might be sensitive as well. So all of these should be handled relatively easily with Advil, Tylenol, any typical pain medication that you usually take. Rarely do I need anything more than that. If you do have an individual tooth, for the first 48 hours, if it's slightly sore, that's normal. But if it bothers you for longer after that, by all means, give me a call. My cell phone's always on the answer machine. So, jaws, teeth, gums, normal soreness. Okay, let's talk about a few more things. There are some important things to discuss, or at least to have handy in your mind so that you know how to proceed going further. First of all, the veneer temp, the temporary you have in your mouth, is very specific. It's there for aesthetic evaluation and to smile. It's not there to eat. So rest assured your final product, the veneers in your mouth, will be able to use them just like you have been your regular teeth. But during this temporary phase, we need to use a lot of care and caution so as not to potentially chip them or damage them in any way. And we've got some strategies for that. First off, you can eat whatever you want to eat. What I just don't want you to do is tear food. Apples, sourdough roll, French bread, pizza, kind of you name it. All those things you'll be able to eat eventually. Just right now with the temporaries, if you're going to eat those things, cut them up, put them in the back of your mouth, and enjoy. Just don't chew them with your front teeth, okay? Secondly, is we provided you a guard, which is like a tray that's going to go over your teeth. I want you to sleep with that every night. And I also want you to use that in the event that we have a small chip or fracture in the temporary. It can happen from time to time. It's not normal, but if it does happen, you can always put that guard in place and no one will notice that you've got a chip in that. And then call me, right? That's just your temporary fix in case you need to. But I do like you sleeping in it every night. It adds an extra layer of insurance that you don't grind your teeth and do some damage while you're sleeping. Okay, now the temporary, what I want you to do is use that as a blueprint. I want you to be critical about it. See if you like the shape of the teeth. Are they too long? Are they too short? Are they too round? Are they too square? These kind of things we can manage and we can alter so that by the time you like the temporaries, that's going to be our point in which we can send that to the lab and say, okay, let's make the final product look just like this. So this is our working blueprint. So be critical about it. Our next visit will be in a few days and we'll be able to kind of go over and make some of those changes if you see anything that you like. And if you like it, great. Then that's what our conversation will be when we see each other next. Finally, we gave you some hydrogen peroxide in some tubes, and I just want you to kind of go around the teeth where the gum and the teeth come together, particularly a week before our final visit where we cement the veneers in place. And all I'm trying to do is get the gum tissue as clean as possible. The better the gum tissue, the smoother the appointment goes on our next long appointment. So I think that should do it. As I mentioned, you have my cell phone. I probably gave that to you already. If I didn't, you can call the answer machine at the front desk to after hours and get it. You can text me, call me. I'm available and I'm around. I want to communicate with you during this process because I think it's so important that you're part of the success of it. Okay, I think that's it. Thanks so much again for your long appointment, for your patience. I realize it's a long one. I think as usual, the results are going to be dynamite. So anyways, thanks so much.